Go.
Hi, Chris. I'm Tom.
Hi,
Nice to meet you. Before we get started, I did need you to please grab a pen here and print your name here and sign here. This is just an informed consent form. It's not release of liability. I'm going to ask you some questions and explain everything to you before we get started. Thank you very much. Have you had chair massage before?
Yes, I have.
Oh, very good. Actually, you know what? I'm going to adjust this right quick. Good. So you know to have a seat facing the chair at your knees on a knee pad. And let us both disinfect our hands before we get started. Yeah, a little bit for you, double shot for me. I do need to ask if you had any flu-like or COVID-19 symptoms or been exposed to anyone with those symptoms within the past 14 days.
No.
All right. Have you had any injury or surgery in the past 3 months?
No.
Might you be pregnant?
No.
Have you started taking any new medication in the past 3 weeks?
No, I
All right.
haven't.
It's good to have eaten within the past 5 hours. Have you done that?
I have.
Good. And will there be any problem with me stretching your shoulders today before we get started?
No, that's
All
fine.
right, cool. Well, my main intent is to help you feel relaxed, but also alert and revitalized. And in the time we have, I'll work on your shoulders, back, arms, hands, neck, and scalp. Is that okay with you?
That sounds good.
Cool. I mainly use acupressure technique, but I'll throw in some Swedish traction and stretching moves. But if I do anything you don't like, just let me know. I'll change it for you.
Okay.
And also, you can stop this massage at any time for any reason. You mind closing that door too? Thanks. Do you have any questions?
I don't think so.
Is there anything else I need to know before we get started?
No.
Thanks, Tim.
Good.
Cool. Let's get you comfortable. Get yourself a long, tall tech stand. Lean forward, tuck your chin to your chest, put it in the face cradle. Chin to chest. Is that comfortable? And maybe I should have left it at the 2. I forgot about your height. But how's that? Is that
That's
okay?
fine.
Yeah, you can remove your mask. Lay your heads in the face cradle. You can put your arms in the armrest if you so desire. Is that okay?
That's good.
Very good. And I'll name these things. Squeeze middle trapezius. Double palm press above the bra line, on or below the bra line, the small of the back, and the sacrum. Traction. And repeat. Squeeze middle trapezius. Double palm press above the bra line, on or below the bra line, the small of the back, and the sacrum with traction. We'll move on over to the left-hand side of the chair. We'll do the arches arm. 1, 2, 3, and repeat. 1, 2, 3, and the single forearm press. 1, 2, 3, and repeat. 1, 2, 3, and then it's the 9 elbow scoops down the erectors. 1, 2. How's the pressure?
It's good.
Very good. 3, 4, 5, 6, 7, 8, and 9. And repeat. 1, 2, 3, 4, 5, 6, 7, 8, and 9. And then we look for the superior angle of the scapula, which is right there. 4 elbow scoops. 1, 2, 3, 4, and repeat. 1, 2, 3, 4, and then we'll roll over the levator scapula, try to find it with our thumb, and roll over it with our elbow at least twice. 1, 2, and then we'll go to the top, front of the chair, do 3 elbow scoops, top of middle trapezius. 1, 2, 3, and repeat. 1, 2, 3. I'm going to work with your arm and hand. I'll come back to your shoulders. 1, 2, 3, 4, 5, and repeat. 1, 2, 3, 4, 5, and then we'll drop down and do the ulnar radius. 1, 2, 3, 4, 5, and repeat. 1, 2, 3, 4, 5. We'll squeeze the wrist twice. We'll do the dragon mouth traction twice. Have the palm face the floor. We'll spread the metacarpals twice. We'll rub between the outside metacarpals and squeeze the pinky and thumb. We'll jiggle. And squeeze the pinky and thumb. We'll jiggle again. And squeeze the pinky and thumb. We'll rub between the inside metacarpals and squeeze pinky ring and thumb index fingers. And we'll jiggle. And squeeze pinky ring and thumb index fingers. And we'll jiggle again. And squeeze pinky ring, thumb index fingers. And then it's pressure to the great eliminator point twice. The palm up, elbow medial. Begin thumbing down the ulna. 1, 2, 3, 4, 5. And repeat. 1, 2, 3, 4, 5. Thumb on top of thumb in between the bones. 1, 2, 3, 4, 5 on the capitate bone. Repeat. 1, 2, 3, 4, 5. Radius. 1, 2, 3, 4, 5. Just distal to the head of the radius. And repeat. 1, 2, 3, 4, 5. And then it's spread the metacarpals twice. And rub in between the outside metacarpals and squeeze the thumb and the pinky and jiggle. And squeeze the thumb and the pinky and jiggle again. And squeeze the thumb and the pinky. And then we'll rub in between the inside metacarpals and squeeze the index finger, pinky ring fingers and jiggle. And squeeze the index finger and pinky ring fingers. And we'll jiggle again. And squeeze the index finger and pinky ring fingers, and then it's pressure to the thenar eminence. And then I'll walk on over to the left-hand side of the chair. We'll do the stretch. 1, 1,000. 2, 1,000. 3, 1,000, and wave to the audience. Very good. And, how are you doing, Chris?
I'm doing good, thank you.
Very good, and let's do the archers on. We'll work on the right side now. 1, 2, 3, and repeat. 1, 2, 3, and a single forearm press. 1, 2, 3, and repeat. 1, 2, 3, and then it's the 9 elbow scoops down the erectors. 1, 2, 3. Pressure still okay?
Yes,
All right.
that's good.
4, 5, 6, 7, 8, and 9. And repeat. 1, 2, 3, 4, 5, 6, 7, 8, and 9. And then it's look for the superior angle of the scapula. I just want to confirm that I found it. Oh yeah, there it is. And 4 elbow scoops along the medial border of the scapula. 1, 2, 3, 4, and repeat. 1, 2, 3, 4, and we'll roll over elevator scapula with our thumb, and then do it again with a half flexed elbow, at least twice, if not 3 times. And then we'll do 3 elbow scoops, top of middle trapezius. 1, 2, 3, and repeat. 1, 2, 3, and we'll go right to the squeeze of biceps, triceps. 2, 3, 4, 5, and repeat. 1, 2, 3, 4, 5, and then the, what's this called? Ulnar radius. 1, 2, 3, 4, 5, and repeat. 1, 2, 3, 4, 5, and then the squeeze of the wrist twice, and the dragon mouth traction twice. Spreading of the metacarpals twice. Rub between the outside metacarpals and squeeze the pinky and the thumb and jiggle. And squeeze the pinky and the thumb. Jiggle again. And squeeze the pinky and the thumb. Rub between the inside metacarpals and squeeze thumb, index finger, pinky ring fingers and jiggle. and squeeze, and jiggle again, and squeeze, and pressure to the great eliminator point, then it's palm up, elbow medial, begin thumbing down the ulna. 3, 4, and 5, just distal to the head of the ulna, and repeat. 1, 2, 3, 4, and 5, and then thumb on top of thumb between the bones. 1, 2, 3, 4, and 5 on the capitate bone, and repeat. 1, 2, 3, 4, and 5, and in the radius, starting in the middle of the crease. 2, 3, 4, and 5, just distal to the head of the radius, and repeat. 1, 2, 3, 4, 5, and then spread the metacarpals twice, and rub in between the outside metacarpals, and squeeze, and jiggle, and squeeze, and jiggle again, and squeeze, and rub in between the inside metacarpals, and squeeze, and jiggle, and squeeze, and jiggle again, and squeeze, and pressure to the great eliminator point the thin arm eminence twice, and go to the side of the chair, and we're going to take out all the slack, stretch the arm in line with the torso. 1, 1,000, 2, 1,000, 3, 1,000, and way to the audience. Here we go. All right, I'm kind of a minute ahead of schedule, but now we're gonna do the low back. Squeeze middle trapezius. Double palm press above the bra line, on or below the bra line, the small of the back and the sacrum with traction. I'm going to do that once. Here comes the dance step. Right foot forward, left foot lateral. No, we're not going to do that yet. We're going to do thumb on top of thumb down the erectors. 1 and 2 and 3. Chris, how's the pressure?
Pressure's good.
All right. 4, 5, 6, 7, 8, and 9 with traction. Hook something on the sacrum and push straight down. And repeat. 1, 2, 3, 4, 5, 6, 7, 8, and 9 with traction. Now comes the dance step. Right foot forward, left foot lateral. Look for the lowest rib. Hook the QL. Push medially. 1. Drop down at thumbs with 2. Just above the iliac crest. 3. And repeat. Hook the QL. 1. Drop down at thumbs with 2. Just above iliac crest. 3. And then we'll reverse the dance step. We're going to do left foot medial, right foot back. Close it up with a single palm press. 1, 2, 3, and 4 with traction. We'll stay behind the customer, but we'll move to the right-hand side of the chair, and we'll open up the right side of the erectors with the heel of our left palm. 1, 2, 3, and 4, and then it's thumb on top of thumb. David Palmer would call this TP thumbs. 1, 2, 3, 4, 5, 6, 7, 8, and 9 with traction, and repeat. 1, 2, 3, 4, 5, 6, 7, 8, and 9 with traction, and then it's left foot forward, right foot lateral. Look for the lowest rib. Hook the QL. 1. Drop down at thumbs with 2. We're pushing medially, and then just above the iliac crest is 3. Find the lowest rib again. Hook the QL. 1. And 2, and 3, and then a little harder. And then we'll do the reverse dance step. It's right foot medial, left foot back. And close up the right side with the heel of our left palm. Single palm press. 3 and 4. Then it's squat down. Look for the as is. Do circular frictioning to the tensor fascia lata. 1, 2, 3, just below the iliac crest and the sides of the sacrum. Repeat. Tensor fascia lata, iliac crest, sides of the sacrum. Light ephemeras, head and tailbone twice. We'll go to the left-hand side of the chair and work on their neck. We'll say, please tuck your chin to your chest while remaining in the face cradle. Is that comfortable?
Yes.
Great. We'll do the neck. We'll squeeze the neck twice. And we'll find the external occipital protuberance and do 1, 2, 3, 4, 5. Drop down the suboccipitals. 1, 2. Base the skull. 3, 4, 5. And then it's line A. 1, 2, 3, 4, and 5 at an angle. And repeat. 1, 2, 3, 4, 5. And then it's line B. 1, 2, 3, 4, 5. And then repeat. 1, 2, 3, 4, 5. And then it's line C, starting just inferior to mastoid process. 1, 2, 3, 4, 5. And repeat. 1, 2, 3, 4, 5. And 3 exclamation points. Shoulder to neck. 1, 2, 3. And repeat. 1, 2, 3. And then we're off to the right side. We say, give me some more chin tuck, please. And we'll squeeze the neck twice. Find the external occipital protuberance and do straight line from there to the middle of the ear. 2, 3, 4, 5. And then it's the base of the skull. 1. How's the pressure?
Good.
2, 3, 4, 5. And then it's line A. Reposition. Reposition the legs. 1, 2, 3, 4, 5. And repeat. 1, 2, 3, 4, 5. And line B. Just one thumbs width lateral from line A. 1, 2, 3, 4, 5. And repeat. 1, 2, 3, 4, 5. And then it's line C. 1, 2, 3, 4, 5. And repeat. 1, 2, 3, 4, 5. And then the exclamation marks. 1, 2, 3. And repeat. 1, 2, 3. And we'll go to the back of the chair. Take a look at the clock. We have 4 minutes. We'll wait a little bit. We'll do a little extra because we're waiting for the clock to get to where I got 3 minutes left.
18:52 on this clock.
Oh, okay, then it also includes the 2-minute, what do you recall it? We did. The 2-minute intro, if it was 2 minutes. I'm working on her insertions of her levator scapula right here, and then also the supraspinatus muscle. But I will move now towards, let's do the, let's finish the neck. Sit up straight and tall. And go ahead and put your mask back on. Thank you so much. And lean your head to the right as long as it doesn't hurt. There we go. Get a little stretch. And to the left as long as there's no pain. A little stretch. And up straight and tall. Stay that way, please, for the rest of the session. Do a little circular friction to the temples. 1, 2, 3, 2, 2, 3. And the 4 positions. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, and repeat. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, and we'll do the right side. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, and repeat. 1, 2, 3, 2, 2, 3, 3, 2, 3, 4, 2, 3, and we'll wash the hair, wash the scalp. Figaro, Figaro. The crab grab and the grand finale. Palms up, palms down, out a half a thumb's width. 1, 2, 3. Thumb screws out. 2, 3, 4. Down. 2, 3, 4. Out. 2, 3, 4. Down. 2, 3, 4. I'm going to bring your arms behind you for a stretch. You tell me when it's a good enough stretch for you. You tell me when it stops. Say when.
When?
Take a deep breath. And arms at your sides. 2 by 4. Squeeze. Squeeze it again. Upper arm squeezes. 1, 2, 3, 4. Repeat. Squeeze. Squeeze it again. Upper arm squeezes. 1, 2, 3, 4. And then the light efferized head, the tailbone twice. Head out the arms twice. Shoulder shrugs. Relax your arms and hands. Let them fall to the ground. 1, 2. Don't help me. 3. Whipping fingers in, down, up, out, in, down, up, out. The right hand meets the left. Praying hands in, down, across and up, and in, out, and in and down, across and up, and out, and 2 wrist fountain. Oops, we forgot the circular efferage of the heart chakra. 2 wrist fountain efferages. And thank you very much. Be careful getting up.
Thank you.
You do. Thank you.